Now for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with more news on the Breast Cancer Awareness Month. Linord?
That's right, Esther. The World Health Organization says breast cancer is the top cancer in women, both in the developed and the developing world. October is Breast Cancer Awareness Month, a worldwide annual campaign to highlight the importance of breast awareness, education, and research. Meanwhile, the 8th Annual International Breast Cancer Prevention Symposium is wrapping up in West Lafayette, Indiana. It is organized by International Breast Cancer and Nutrition. And joining me live via Skype from West Lafayette, Indiana for more is Professor Sophie Lelievre, Professor of Cancer Pharmacology with Purdue University and co-leader of International Breast Cancer and Nutrition. Also joining us via Skype from West Lafayette is Dr. Beatrice Wiafe-Addai, CEO of Ghana Peace and Love Hospitals and President and founder of Breast Care International. Thank you both for joining us.
Thank you for having us.
So let me start with you, Professor Lelievre. Talk to us about the symposium. This is the 8th edition. How far have we come with regards to the fight against breast cancer as it pertains to the conference?
Well, we have gone quite far because we have now reached the level of applications with this symposium being dedicated to technologies. So we have actually heard from engineers of how they will be able to help better assess risk, hopefully in the near future, without any invasive methods, of course, risk for breast cancer. And this is a major advance for us to have our engineer collaborators join in this conference. So that's one thing. And the second thing is that we have realized that beyond nutrition, which is an important factor in risk for breast cancer, we have to also look at how the food we eat is affected by the environment, pollution, and so on in the plants. And this is an important aspect that we have to integrate now in our studies.
Great. And Dr. Wiafe-Addai, let me come to you. We talked about how far we've come. What about what is happening on the continent with regards to African women and Ghanaian women in particular?
Thank you so much. Yes, we are happy to be part of this International Breast Cancer and Nutrition project because it's one of the few organizations that's looking at how we can prevent breast cancer and at the epigenome level. In Africa and in Ghana, we have a lot of cases, even though our overall incidence is not that huge as compared to the developed world. The mortality is too high, unacceptably too high. And so we are doing all we can to help our women to come to the hospital early so we can have early stage disease for meaningful treatment. Unfortunately, our women are not coming early, so they are dying. A lot of women are dying needlessly and prematurely from breast cancer. So it's important for us to have this collaboration and to learn what is new in the cancer world so we can apply it.
Okay, and Professor Lelievre, when we look at innovation in terms of prevention, which is really one of the key aspects that you are looking at during this symposium, what do you see as the way forward that could, the innovation that we should look forward to?
Well, I think that one of the major innovation is that we are realizing that we need to act extremely early during life, meaning that we have to work with families to look at how to prevent the risk for breast cancer or decrease the risk for breast cancer actually already from childhood by really modifying how we interact with the environment. So that's really important that we start early on when it says exercise and so on, which is good anyway. It has to be happening already extremely early in age. And if we implement that already, it's going to make a major difference. And the other thing is we see that there's actually now more awareness about the importance of stopping cancer before it starts. Yeah. And this is starting to change the view of some of our policymakers. Not enough, but this will be very important. We have to have that happen. Otherwise, we won't be able to really make strides fast in the future. So this is, I think, the two major things.
Okay, and Dr. Wiafe-Addai, Professor Lelievre mentioned earlier nutrition. To what extent are women in Africa, in where you are, aware of the fact that there may be a connection between what we eat and the development of breast cancer?
Yes, that is one of the things that we are trying to let our women know. And what we have to also bear in mind is that we still don't know the exact cause of breast cancer. So all we can do is to act on the risk factors that we can change. And these can be lifestyle changes. The nutrition is very important because, you know, in Africa, our diet is always very heavy, and lack of exercise is also having a toll on us. And the other non-communicables like diabetes. So we need to try and tell our women to eat healthy and to exercise a little, and also to go away from alcohol, excessive alcohol consumption, and cigarette smoking. These are things we can do to help ourselves, since we cannot stop the disease from coming at the moment.
Okay. And Professor Lelievre, when we talk about eating healthy, can you give us a sense of what we're looking at? What can be a good prevention steps in terms of what to eat?
Well, we already know that whatever food is pro-inflammatory is a danger. So that means too much sugar or too much of the type of fats that would be like sometimes in the meat and so on. And the problem is that it's although we know this is important to eat healthy, we need to adapt to each population. This is what makes the things a little bit difficult to do. But definitely having one type of diet is not good enough. We have to diversify our diet and try to avoid at all cost processed food. That's for sure is now shown to be extremely detrimental. So the more processed the food, either to keep it from being spoiled or just to make it, different type of food we can buy. It's easy to eat and so on. We should avoid that. We should actually go back to the ancestral way of eating that we have lost, unfortunately.
Okay. And Dr. Wiafe-Addai, when we look at women in Africa and perhaps the role that public policies and even leaders can play, what do you see, where should be the focus to help to contribute to this fight?
Yeah, thank you so much. In fact, a lot needs to be done. When you see how the developed world is putting in so much on research. And so we need to also, apart from educating our people and creating awareness, we have to help our women to access help, to be able to get the help they need, irrespective of where they live, and also to try and minimize the harmful effects of pesticides and those chemicals that we use in our farms, because all those things come into the food that we consume, and we know that they are not good for our health. Okay. So we will ask our policymakers to put in more effort to, prevent disease and to help those who have already contracted the diseases.
Thank you. We have to leave it there. Dr. Wiafe-Addai, thank you so much for joining us, along with Professor Lelievre, and that was Professor Sophie Lelievre. She is co-leader of International Breast Cancer and Nutrition, and Dr. Beatrice Wiafe-Addai. She is president and founder of Breast Care International.